This is the TechDental Podcast, the strategic intelligence hub for leaders shaping the dental industry. We break down how AI, data, and operating discipline drive performance and scale. I'm Dr. Randeep. Let's dive in. Welcome back to the TechDental Podcast. Dentistry has digitized almost everything: records, imaging, compliance, and reporting. And yet admin pressure has never been higher. Clinicians feel more burdened, burnout is rising, clinical capacity is quietly eroding. So the question is not whether dentistry needs more technology, it's whether we've designed the operating system properly. My guest today sits right at that intersection. Dr. Suzanne is a clinician by background, now working at enterprise level on how AI can reduce documentation load, protect clinical intent, and improve performance without compromising on the governance. This is not a conversation about tools, it's about reclaiming time, trust, and clinical capacity. Suzanne, welcome to the show.
Thank you so much for having me. I've been really excited to speak to you today.
Dentistry has digitized records, but admin pressure keeps rising. From your perspective, where does documentation most quietly erode clinical capacity and morale?
So for me, it's in those mundane, constant, repetitive admin tasks that add up. So those few minutes after every appointment where you're finishing your notes, you're writing your radiograph reports, you're doing your referrals, you're making sure that you've covered yourself dentolegally over a full clinical day, that's huge. And by the end of the day, it can quite easily add up to an extra hour of admin. And that time, it spills into lunch, into gaps between patients, or into the end of the day when you're already tired. And I think that's when morale really takes a hit, when your clinical day is technically over, but you're still stuck at the computer finishing notes. And it's also mentally draining because documentation, it does require focus, but not clinical creativity. So you're using your brain, but just not in a very rewarding way. And for me, over time, I found that constant low-level cognitive load really quite exhausting. And that's a huge part of what pushed me to actually look for better ways to handle that work.
Is burnout in dentistry primarily a well-being issue, or is it actually an operating system failure that you think we've normalized?
I think primarily it's an operating system failure. So I think that some people are more predisposed to burnout and others might have a higher tolerance for working in challenging systems. And that's why some people dream of becoming doctors or dentists and others couldn't think of anything worse. But overall, I think it is a system failure. We talk a lot about things like mindfulness and self-care, and those things matter and they're important, but they don't fix a broken operating model. If your diary is literally designed with no buffer, constant time pressure, heavy admin, patient overload, and no recovery time, then I think that burnout is actually a very valid and normal and fair response, and you can't mindfulness your way out of that situation. And I also see burnout as feedback. It's feedback that something somewhere isn't quite right. So if you have high levels of burnout in a particular practice or a particular industry or a particular team, then it's a signal that something's not quite right there. And for me, when I was practicing, I didn't burn out because I didn't care. It was the opposite. I felt burnt out because I cared too much and the system also demanded too much all the time. And it was the biggest reason why I moved into health tech. I realized that unless we change how work flows, how admin is handled, how technology supports clinicians and healthcare delivery, then we're just going to keep seeing the same problems repeat. And I chose Heidi specifically because I wanted to work on tech that redesigns how admin fits around the clinical day and not the other way around.
I think what strikes me is that most leaders still see documentation really as a compliance cost, but in reality, I like to frame it as a capacity tax, and it compounds silently across clinicians, across days and years. And I think that really leads us naturally to the idea of ambient AI and what it's really trying to solve. Ambient AI gets talked about a lot, often quite loosely. You've described it as fundamentally different from dictation or transcription. What's the difference in practice?
That's a great question and very happy to clarify, because I don't know if even dictation or transcription is that heavily used or understood in dentistry as much as it is outside of dentistry and other areas of healthcare. So with dictation or transcription, you're typically like a narrator, whereas ambient AI is different because it's fading into the background rather than interrupting the flow of the appointment. So it listens passively in the background whilst you carry out a natural, normal appointment. You're talking to your patient as you normally would, and the system is just there listening and understanding the context of the appointment. And that means that you can maintain eye contact with the patient, which patients generally really because it makes them feel heard. And they're not used to their caregiver giving them their full attention and not typing away while they speak. You can focus on the patient, you can stay present in the interaction, and you're not necessarily thinking about how am I going to document this or what do I need to do next or what are all the tasks that are piling up. And the other big difference is what you get at the end. So typically with dictation or transcription, you get a word for word transcript, like a raw block of text of everything that was said, including the irrelevant bits. And then it's on you to turn that into a proper clinical note. But ambient AI is a bit more advanced in that it can understand the context, it knows what's relevant, and it takes it that step further. So it filters out the irrelevant information, the noise, and turns that conversation into a structured, usable clinical note that reflects how we would write our notes in dentistry normally. The last thing that I want to highlight, which is my favorite point, is with ambient AI, when it's working well, you almost forget that it's there. So with our users, a lot of them will just say that they notice that their notes are complete and they're feeling that their notes are better than they've ever been before, which I've genuinely heard from some of our users, but they're not staying behind late to finish them. And I think that's a sign of a great product when you're noticing the positive benefits and the impact that the product is having on you, but not necessarily the steps of you using the product.
And I think you mentioned this and you really hit the nail on the head there because dentistry is quite nuanced and judgment heavy. How do you ensure AI captures clinical intent and not just the language?
Yeah, very good question. And I think this is where the human element is absolutely essential. Anything that is produced by AI still needs to be reviewed and checked, whether that's in dentistry or any other field. And we already know with tools like ChatGPT that AI can sometimes get things wrong. And that's why verification is so important. In dentistry, that responsibility is even greater, and in healthcare, because you're ultimately responsible for someone's health. So ensuring that AI truly reflects clinical intent has to remain the responsibility of the dentist. If you start using AI as a complete replacement for your clinical judgment, your decision making, your expertise, then it's simply not going to capture that intent properly. If we take something like an AI note taker, you can't just let the AI note taker write down the conversation and then just drop that straight into the patient record. You should be reviewing it and you should ask yourself, is there anything that I would change or add? And I'd very much encourage people to use AI responsibly as a support tool rather than as a substitute. So used, it can make your working day a ton easier and free up mental space for more complex clinical decisions. But at the end of the day, you're the clinician, you're responsible for the final output and for making sure that anything generated by AI is meeting the same high standards that you would expect from yourself.
And I think this really feels like a subtle but critical shift for our listeners because what we're doing is we're not talking about automating notes. We're really redesigning how clinical thinking is translated into records safely. There's a lot of noise around AI in dentistry. From your vantage point, where is AI genuinely useful today and where is it being oversold? It may be possible for you to tell. I know your area is clinical notes, but it would be nice to get your opinion on the AI landscape more widely.
Yeah, really good question. I definitely agree there is a lot of noise around AI in dentistry, not just in dentistry, actually, in general. I'm constantly seeing AI videos and memes going around. And I think with dentistry, I'm hearing every day that it's AI this and AI that. Very conscious that there is a lot of noise at the moment. Right now, I think that AI is most useful in those background tasks and workflows that I mentioned earlier. So those repetitive, mundane tasks that don't need your full clinical brain. If I start with an example of writing notes, I would describe it as a bit of a chore in the world of dentistry. So I think anything that's going to help to diminish or reduce those chores that we dislike so much, there should be more hype around them. And we've got some amazing dental groups and practices that are really starting to take advantage of Heidi and reap benefits and see that this is actually something super powerful and something that we should be implementing as part of our standard day-to-day practice. Other areas I think it can support with task management, telephone calls, etc. Where I think it could be oversold is where it's sold as a replacement for clinical judgment. I think that's when it's probably not realistic and it's not what most clinicians want anyway and not what patients want. So overall, I think the best AI tools are ones that don't try to be the dentist, but they just try to support the dentist with background tasks or partner with the dentist.
Suzanne, how should leaders think about AI not as a feature, but as a decision support layer across the business while preserving clinical governance?
So I think the starting point for leaders is don't pick the product that has the most features or looks the flashiest. but start by identifying the actual pain points in day-to-day workflows. So where are your staff or clinicians repeatedly getting stuck, and what do they complain the most about? And which tasks are taking them longer than they should, and what's costing you the most? Basically figure out where are the bottlenecks, and that's where AI or automation will make the biggest difference. And once those pain points are clear, then leaders can start to think about AI as a tool that supports decision making. They can give staff the right tools to make those faster, more accurate decisions without having to chase down data or repeat tasks. And the other point is to start small and be deliberate. So don't try to automate everything at once. Just pick one area of the workflow. For example, writing notes, if that's causing frustration or inefficiency, pick that, solve that first, and then let the team see the benefit. And often if you fix one workflow, it will make the impact obvious and it will build confidence in your team. And that then makes it easier to scale AI support to other areas in their workflow.
Yeah, and I think this is really where a lot of organizations get it wrong. They ask, does this save time instead of, does this preserve judgment and reduce risk at scale? A recurring theme on the TechDental is that AI multiplies existing culture. How does that show up in clinical documentation as practices scale?
I've seen this play out in practices, and essentially the clinicians that are most motivated to improve their workflow, improve the process of clinical documentation, that are curious about new tools or what we call early adopters, they're the ones that are most likely to use AI effectively. And when they start to use it and they see real benefits, such as finishing their notes on time, leaving on time, less stress, then that becomes visible to the rest of the team. And that's when it creates a positive cycle. And you'll often find colleagues coming and saying, when can I use this? I've seen it with so-and-so, now I want to try it. And colleagues will notice that the workflow becomes smoother without compromising care. It makes them more willing to engage with the technology, and then the adoption will spread naturally. On the other hand, in teams where there isn't that motivation or curiosity, it can be trickier because AI isn't going to magically fix low engagement or interest in improving workflows. You still need that initial spark or curiosity. So adoption in those cases can stall. And I think it's a shame because the team then misses out on some really amazing benefits. So I think that is why leadership and championing from motivated clinicians is so important, especially as you scale. When the culture is open and improvement focused, then AI will help not just those small individuals, but actually the whole team work better.
And when leaders worry about data, privacy, risk, what questions should they actually be asking vendors before adoption?
Yeah, this is really important, and they should be asking practical questions. So they should be asking things like, where is the data stored and who owns it? Is the data used to train models, and how is consent handled? The way that a vendor answers these questions, and if they answer these questions, will tell you a lot about how seriously they take this topic, and they should definitely be taking it very seriously. So when you think about who owns the data, then the practice or the clinician should always retain control of the clinical note. When you think about what is the data used for, you should ask, is it just to deliver the service, or is it also used for AI training? And if it's used for AI training, is that optional and is it de-identified? When you think about where is the data stored, of course, country or region matters. So you should ask about encryption and access controls. And then the final one is to ask what happens if something goes wrong. And hopefully nothing goes wrong. And most of the time, nothing does go wrong. But you should definitely be asking that prior to working with a vendor.
And I think what becomes clear really is that AI doesn't remove responsibility, it actually concentrates it. And I think you've hit the nail on the head with the explanations that you've given there. Suzanne, I always like to finish up with a quick lightning round, which is short, sharp answers that really move the needle for our listeners. So we'll go ahead and start with our first one. What's one admin task in dentistry that should never be manual again?
It's hard to pick one because there's so many. I will say clinical notes and referrals when you're having to copy and paste information between the two. It's just duplicating unnecessary work, and it shouldn't be happening in 2026.
And give me one misconception clinicians have about AI note takers or ambient AI in general.
Does it have to be one?
You can pick a few. I know it's your subject area, so I'll let you pick a few.
There are three main ones that I hear the most. The first one is that you lose control of your notes, which is not true. With the right product, you can absolutely have the AI writing notes like how you normally would write them. The second would be that you have to change how you speak or practice. that's also not true. If anything, you might have to verbalize what you're doing ever so slightly more, but that's actually positive. Patients like to be involved in the treatment. I always get told that it's the most thorough checkup I've done if I actually talk to the patient and tell them what I'm doing. So I think actually that's a positive change. And the final misconception would be that they're risky if you don't understand them. They're very simple to use. We have people of varying levels of tech savviness that use Heidi very successfully. So those would be my top 3.
Yeah, I'm glad I let you elaborate on that, because I think one of the themes we've covered is a lot of people feel quite overwhelmed by the technology and they may not be tech savvy. So it's nice that even the not so tech savvy can harness the power of something like AI note taking. And my final one here, Suzanne, what's one metric that best reflects reclaimed clinical capacity?
We could keep it really simple and just say, how long does it take you to write the average note? Or you could think about how much overtime do you spend writing notes? So how much of your lunch break and after work do you spend writing notes? Because then you can multiply that by your hourly rate and then you get some kind of monetary value as to what you're actually spending on your note taking.
Fantastic. And yeah, this is very close to my heart, being a clinician myself. So I many a time remember writing up the notes into the late evening, and you obviously can't take them home, but yeah, you would stay at the practice pretty late to do that. So I'm quite excited about where AI is going with note taking in particular. Suzanne, thanks for joining us. It's been a great conversation. Where can people connect with you and learn more?
Cool. So you can find me on LinkedIn, Dr Suzanne Abbas, or you can head to our website, which is heidihealth.com.
The real takeaway for leaders is this, that AI doesn't replace clinicians. It either protects their judgment or it exposes weak systems. If this episode resonated with you, share it with a colleague or leadership team today. And if you want more conversations like this grounded in clinical reality and systems thinking, subscribe to the TechDental Podcast. You've been listening to the TechDental Podcast, strategic intelligence for dental leaders navigating structural change. If you're responsible for growth, performance, or long-term value in this industry, make sure you're subscribed. I'm your host, Dr. Randeep. We'll see you next week.